Sir, would you please rise and raise your right hand? Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Please be seated. Please state your name for the record. Spell your first and last name.
Yes, ma'am. First name is Martin, M-A-R-T-I-N. Last name is Blount, B-L-O-U-N-T.
Firefighter Blount, good afternoon, sir.
Hello, sir.
Let me provide you with some instructions, which I give to every witness in every case. The first, please sit back and relax. The second, please speak in a loud voice so we can hear you. The third, if you're called upon to provide a yes or no answer, answer that way rather than using slang like And lastly, please wait until you hear an entire question before you even start to respond. Many of us every day think we know what question is going to be asked, so we start to, or it's asked in its entirety. In court, just wait for the entire question. Is that all right?
Yes, sir.
Thank you. Correct? Ms. Blount.
Thank you, Your Honor. Good afternoon, sir.
Hello, ma'am.
What do you do for a living?
I'm a Los Angeles City firefighter paramedic.
How long have you worked for the fire department?
20 years, ma'am.
Have you been a paramedic the entire time you've been employed by the fire department?
No, ma'am. I became a paramedic in 1999.
Describe for me, please, your paramedic training. What did it consist of?
The paramedic training was altogether was for a year. Once we got there, we did 6 months of didactics, and then we went into clinical field. Then we went out into the field for 4 months of on-job training.
Who taught those classes?
UCLA paramedic instructors.
Doctors and nurses?
Yes, ma'am.
And your experience in the field also supervised by more experienced medics?
Yes, ma'am.
Is there a recertification process that you undertake to maintain your paramedic certification?
Yes, ma'am. It's called continuing education, and that's every 48 months you have to redo your license.
I'm sorry, I wasn't able to hear what
I'm
you
sorry,
said.
it's called,
We have a cough.
I'm sorry. It's called continuing education, and it's every 48. It's for 48 hours for every 2 years.
So every 2 years, you're required to take 40 hours
48 hours. I'm sorry.
48 hours?
Yes, ma'am.
Moving to June 25th, 2009, sir, where were you assigned in your employment with Los Angeles Fire Department?
Fire Station 71. The address was 107 South Beverly Glen Boulevard, on the corner of Sunset and Beverly Glen.
Did you respond to a radio call coming into your station at approximately 12:21, directing you to an address 100 North Carrollwood Drive?
Yes, ma'am.
Is that basically just down the street from your Fire Station 71?
Yes, ma'am.
Did you ride in a fire truck or a rescue ambulance to the location?
Rescue ambulance, ma'am.
Were you the driver or the passenger?
Driver.
Who was the passenger?
Firefighter paramedic Richard Sineff.
When you arrived at the Carrollwood location, you parked your vehicle
Yes, ma'am.
in front of the residence,
Yes, ma'am.
inside the gates,
Yes, ma'am.
near the front door.
Yes, ma'am.
After you parked the rescue ambulance, did you go inside the residence?
Yes, ma'am.
Were you assisted by individuals directing you to the proper location inside the residence?
Yes, ma'am.
Who were those individuals, if you know?
It was bodyguards on the staff.
On the staff?
On site, yeah, on site.
Besides yourself and your partner, Rich Sineff, were there other rescue personnel who responded to Carrollwood?
Yes, ma'am.
Who were those individuals?
First was our captain, was named Captain Jeff Mills, firefighter Brett Herring, and firefighter paramedic Mark Goodwin.
Did those individuals arrive on a fire truck?
Yes, ma'am.
Fire truck parked outside the residence on the street?
Yes, ma'am.
Did you enter the residence and proceed upstairs to the location where you were informed a patient needed assistance?
Yes, ma'am.
Were there other individuals in your paramedic group who entered the bedroom before you?
Yes, ma'am.
When you entered the bedroom, what did you see?
I saw a gentleman laying on the bed when when I got upstairs.
Was the patient fully on the bed or partially on the bed?
He was fully on the bed, ma'am.
And did you see someone that you see in the courtroom in the resident's bedroom as well as the patient?
Yes, ma'am.
Is that individual seated here, Dr. Conrad Murray, in the dark suit and the white shirt?
Yes, ma'am.
Indicating, thank you, Your Honor, indicating the defendant?
Yes.
Once you step inside the bedroom, tell me what you see going on by those who've entered before you.
Two of our individuals, it was Mark Goodwin and Brett Herring, was assisting Dr. Murray, helping the individual off the bed onto the floor.
Did you see anyone other than Dr. Murray, aside from your group of rescue personnel, inside the bedroom at the time that you entered?
No, ma'am.
Describe, please, your observations of Dr. Murray when you entered the bedroom.
He was a little flustered, ma'am. He was sweating profusely, and he was a little agitated.
Did you hear him say anything when you entered the room?
Yes, ma'am.
What is that?
He say he needs help. Could you help him, please?
As the driver of the rescue ambulance, do you have a particular role pre-assigned that you will be performing when you attend to the emergency once you've arrived?
Yes, ma'am.
What was your designated role when you arrived to Carrollwood?
I was the driver, and I was considered the patient person, and my job is to initial treatment and assessment of the patient.
So you're directly hands-on with the patient, correct?
Yes, ma'am.
And your partner, Richard, he was the passenger. Did he have a different role?
Yes, ma'am.
Was he the communications person? Obtain information, convey information to rescue personnel located off-site?
Yes, ma'am.
When you entered into the room, strike that. When you entered the room and you saw the patient, did you recognize who the patient was?
Yes, ma'am.
Did you immediately recognize him?
Yes, ma'am.
And you recognized him to be Mr. Michael Jackson, correct?
Yes, ma'am.
Once you are inside the room, you've made the recognition that the patient is Michael Jackson in distress. Do you see your colleagues relocating Mr. Jackson to an area at the foot of the bed?
Yes, ma'am.
Once Mr. Jackson is located at the foot of the bed, do you begin particular efforts as part of your designated job to assist him?
Yes, ma'am.
Describe what you did, please.
Yes, once we all arrived on scene, we got there. First thing I did was I had my medical box and my defibrillator in my hand. I went up to the head of the patient and opened it up and start basic life supports, which was CPR on the patient. What we did was one of the individuals started doing compressions, and I started giving breaths for the patient. I pulled out my BVM, which is ambu bag, and I started to breathing for my patient at that time.
Let me stop you there for a second. Let's just focus on your basic life support efforts.
Okay.
And if I understand your testimony correctly, your job is to provide air to Mr. Jackson, correct?
Yes, ma'am.
Independent of chest compressions and CPR, just focusing away. Would you characterize that as being the most important life-saving function that should start immediately, and you did start it immediately?
Yes, ma'am.
And you used the phrase basic life support, correct?
Yes, ma'am.
Now I want to focus just on the steps that are encompassed within your characterization of basic life support. Prior to the time that you introduced the ambu bag into your efforts, did you use a tongue suppressor to assist you in any way?
Yes, ma'am.
Describe what you did, please, and what the function was of the tongue suppressor.
Okay. It's we call it oropharyngeal. I'm sorry. It's called the OP airway.
Can you spell the word you used, please?
It's oropharyngeal. That's what it's called, airway. And what it does is that's like a tongue suppressor. And what it does is that you stick in and insert it into the mouth to depress the tongue, so the tongue would not go in the back of the mouth to stop the air from going in.
Would that be similar to when you're a child and you go to the doctor and a tongue suppressor is placed on your mouth so the doctor can look down your throat, only a more sophisticated version?
Yes, ma'am.
So the tongue suppressor is utilized by you to hold the tongue down to make your job easier with the airway assistance?
Yes, ma'am.
So once you put the tongue suppressor in the mouth, what's the next step that you take in your basic life support endeavor?
Head tilt, chin left. I took the head and tilted back a little bit so that way it'd be a clear view, a clear focus into the lungs, so it would be no obstructions.
So you take Mr. Jackson's head and you tilt it slightly and in a way to make the airway be as clear and unobstructed as possible so that if he's breathing, he can breathe, correct?
Yes, ma'am.
Do you then utilize the ambu bag to further assist in this basic life support for breath?
Yes, ma'am.
Describe how that works, please.
It's like artificial air. Normally people will come down and give you breaths, but all it does is that it's like a big ball. And what it does is that it has a mask on it, and you cover the nose and the mouth with it, and you blow into it, and it's just like blowing into a person's mouth with your mouth itself. And when you depress it, it automatically inflates itself again.
Is a more efficient method than mouth-to-mouth resuscitation where one person's mouth's on the victim's mouth?
Yes, ma'am.
Do you utilize an oxygen tank in any way with the ambu bag apparatus?
Yes, ma'am.
And did you, in fact, utilize an oxygen tank when you affixed the ambu bag and the suction mask to Mr. Jackson's face?
Yes, ma'am.
Was that an oxygen tank that you brought with you?
Yes, ma'am.
Did you complete all of these basic life support steps by yourself?
Yes, ma'am.
And approximately how much time in minutes or seconds would you estimate that it took for you to accomplish these very basic steps that you just described for us?
A minute or so, ma'am.